Digital media and mainstream media alike was alarmed earlier on in the year when a family was asked to pay almost 1 million shillings of an intensive care unit bill accrued in almost 24 hours, despite their loved one not making it out alive. This brought to light the high cost of I.C.U. care in Kenya, particularly in the private health sector, and the deficiencies in the public health sector. In your health budget, Dr. Mombasa Road looks into this cost.
It can support a number of things for the baby.
What goes through your mind when you hear of the intensive care unit? Do you think that that's a point of no return when in the hospital? What of the cost that you may incur? That is exactly where Josephat and his wife Miriam found themselves when their newborn son Ryan developed complications soon after birth and was in urgent need of intensive care.
We had not seen any sign of sickness. He just started shaking his hand. We were told it's a conversion.
Like many other Kenyans living far from major cities and towns, Ryan had to be referred from Voi to a private hospital in Nairobi, 350 kilometers away, to get the ideal intensive care for a newborn.
The difference is that later they had no enough facilities. So the baby was just given simple medication.
Why then is intensive care for children not readily available?
Traditionally, I.C.Us have been there to support respiratory, breathing, and heart problems mainly. The newborns, they require simple ventilators called the CPAP, which are cheap, affordable, and easy to learn. The second thing, there should be monitors. Things to monitor how well are we doing, because after every intervention there should be an assessment and then a team to work with these machines.
These doors are able to.
This initial capital cost partially explains why one is required to part with hefty sums of money first as deposit, whether your child makes it out alive or not.
We have a lot of disorganized interventions whereby you find a hospital that doesn't have good outpatient care, good inpatient care, but they are putting up a corner or one room and putting a ventilator and calling that an I.C.U. So that cannot serve as an I.C.U. Two, you have hospitals that have got no specialists for in critical care. Then there are people who are just drawn from any department and then given a patient to manage.
The cost of intensive care in public hospitals would be significantly lower than in private facilities.
Depends on which cover one is on, because if they are civil servant, it is fully covered. If they are private subscribers, that anyone who is not a civil servant who is on NHIF, then there is a minimum amount that they will cover. It's not great.
Despite having an NHIF cover, Josephat and Miriam still find themselves unable to pay their son's hospital bill that is now at almost 1 million shillings and counting.
So based on their condition, you'll find a patient spending anything between 5,000 and 50,000 per day.
Currently, we are just stranded. But NHIF is just giving us 4,000 per day. And the bed costs 30,000 per day.
The biggest hospital in the country, public hospital, Kenyatta, took more than 100 years of its existence to have a pediatric I.C.U. And the other provincial hospitals, the so-called provincial hospitals of that time, now counter-referral hospitals, many of them have an adult room taking care of critically ill patients. They may or they may not have the team. We still need a lot of investing in pediatric I.C.Us.
Until this happens, the best thing would be to have an insurance cover that can cushion you in the event that your child needs intensive care. A pediatric I.C.U. may form part of the care that your child may receive when admitted in a hospital. And before you close that probability that your child may land in an I.C.U., find out how much that will cost you. Dr. Mombasa Road for your health budget, KTN News.
This is KTN News.